Hey there, I'm Dr. Josie DeVideo. I'm a longtime dentist, a registered yoga teacher, and a certified wellness consultant. Today we're diving into the world of three-part breathing, also known as diaphragmatic or abdominal breathing. It's a simple yet powerful tool to combat stress, enhance focus, and rejuvenate our busy lives. Let's face it, our profession demands precision, patience, and an unwavering calm, often in the midst of a whirlwind day. And between patient care, paperwork, and deadlines, stress can build up quickly. But what if there was a simple, effective technique that you could use to manage that stress right in the office? That is where three-part breathing becomes our silent ally. It's not just about taking a moment to catch our breath, it's about recharging our mind, our body, and our spirit to be the best we can be for our patients and for ourselves. This practice is beautifully simple and can be done anywhere. Yes, even in your office chair between appointments. It involves breathing deeply and fully in three parts. All right, so essentially in three-part breathing, we're looking at our breathing system as if it was made up of three sections. So when we first inhale, we're going to be focusing on our belly, our abdomen. In the second section, we're going to be focusing on our rib cage. And then in the third section, we're going to be focusing on our upper chest, just under the clavicle. So we're going to first completely breathe in through our belly, noticing the expansion. Exhale completely out from our belly. Then we're going to inhale through our belly, and then expand into the rib cage, and then exhale completely out from the rib cage first, and then the belly. And then we're going to inhale belly to rib cage to all the way under our clavicle, and then exhale completely clavicle first, then rib cage, and then belly. Now I know I said that fast, but don't worry, I'm going to say it again, and then we're going to practice. This technique maximizes oxygen intake, it triggers the body's relaxation response, and it can significantly reduce stress levels. And in a minute, I'll walk you through each step, providing tips to ensure you're getting the most out of this practice. So whether you're a seasoned yoga practitioner or someone who's just starting to explore wellness techniques, three-part breathing is an accessible method to enhance your daily life and dental practice. This technique uses your diaphragm to create deep cleansing breaths that activate the body's relaxation response. And studies show that by focusing on your breath, you can reduce stress and anxiety, improve focus and concentration, lower blood pressure, and increase feelings of calm. Now let's put this theory into practice. Find a comfortable seated position where you can relax your shoulders and back. And close your eyes if that feels comfortable for you, or you can keep them open with a soft gaze. All right, so first will be the belly breath. Imagine your belly as a balloon and inhale slowly through your nose. Feel your belly inflate with air. Hold for a moment, and then exhale slowly through your nose, drawing your belly button back towards your spine. Once you've mastered the belly breath, we're going to add the rib cage. So inhale through your nose, filling your belly first, then letting that breath expand into your rib cage, pushing the ribs outwards. And then exhale slowly through your nose, emptying the rib cage first and then the belly, bringing your mindful attention to those spaces. Now for the complete three-part breath. First, you're going to inhale through your nose, filling your belly, then your rib cage, filling it completely, and then finally allowing a little air to fill your upper chest, all the way up under your clavicle, because your lungs extend that far up. Exhale then slowly, emptying the upper part of your chest, then the rib cage, and then the belly. All right, so that is the three parts of the three-part breath. So now we're going to do it again. We're going to cue it a little bit differently, but keep your mind's eye into the body parts that we're filling with there. Part one, inhale through your nose, allowing your belly to expand softly, and then exhale through your nose, tightening your abdominal muscles and drawing your belly button to the spine, allowing as much air as possible to escape from your lungs. Then we'll move on to part two. Inhale through the nose, allowing your belly to expand, and then allow the breath to expand your rib cage as well. And when you exhale through the nose, squeeze the air out of your rib cage first, and then the belly, until they're completely empty. Then part three. Inhale through the nose, allowing your belly to expand as the breath moves into your lungs, expanding the rib cage, and then invite the breath into your upper chest, to your pectoralis muscles, to just under the clavicle. And then exhale fully, starting from the top of the lungs and pushing that air out through the rib cage and out your belly. And then when you're ready, you can open your eyes. This technique is a gentle reminder that sometimes the simplest practices can profoundly impact our lives and elevate the care we provide to our patients. We can all use a little stress relief, even in the midst of a busy day. So the good news is you don't need a big chunk of time to find that relief. Sneak in short moments of mindfulness during your breaks, especially while you're waiting for x-rays or even in between patients. These tiny pockets of calm can make a big difference. But like any skill, 3-part breathing takes practice. Practice, not perfection. So start with a few minutes a day and gradually increase the duration as you become more comfortable. A few minutes of focus on your breath can make a world of difference in managing stress and promoting overall well-being. So if you've enjoyed this episode, give it a thumbs up and subscribe so that I know to create more content like this for you. And then share this episode with your dental colleagues. Let's create a wellness community where self-care is as vital as patient care. Be well, friends.